We need eventually both evolution and revolution. And a couple of years ago, along with several colleagues, some of them are in the panels today, we published that paper, which is a manifesto for reproducible research, and thinking about the different stages of research that one could intervene and improve the outcomes, the credibility, the reproducibility, and the usefulness of research. There's multiple stakeholders involved in that process, and not any single one of them can do everything. There's journals, there's publishers, there's funding agencies, there's professional societies, there's sometimes the general public can do a lot. I mean, currently we live in an environment where there's a lot of anti-science angst surrounding us, and I think that we can work with the general public to make them understand how difficult science is, how noble it is, and how we can, and we want their help to get it better. These different stakeholders have different priorities. Many of us love publishing papers. Many of us want to get funded, and this is, of course, understandable. Many want to see things translated, and of course, this makes sense. And many want to make profit, and there's nothing wrong with that. We need to find ways to integrate all of these stakeholders to work towards a common goal, a common direction of getting the best possible science in a most efficient way. So I will close with these conclusions. The reproducibility and usefulness of many disciplines in biomedical research and beyond has substantial room for improvement. There are many possible interventions that may improve the research practices and enhance the credibility of the scientific investigation. Fostering excellence requires proper incentives that align with this goal, and much of what we incentivize currently may need to be revisited, hopefully with evidence. Closing with some special thanks to a number of my colleagues who have contributed to the empirical data that I showed you today, and with many thanks to all of you for listening. Thank you.
This on? Okay, good. Thanks, John. Maybe we could, if there are questions, a couple of people could line up, and at the same time, maybe I'd invite the panel, the next panel, to come to the podium.
And I'll get into trouble. I am helping to put together a database for pediatric research. We have about 1 million patients, and of course, many different factors such as diagnoses, treatments, what have you. And as you've pointed out, there's a lot of potential for abuse because of all the factors that we looked at. What advice would you give us in setting up this database and making it available? We're already planning to register analysis plans and have them approved by committee.
So if you're doing this for the first time in the field, and there's no precedent, it's both a blessing and a curse, because there's no established rule. You need to set up the rules, and maybe one can use some rules from other fields that may have done that, but there's always some peculiarities about each field, what exactly is being measured, how it's measured, what is the reliability of different types of measurements within that database. Some key principles, and obviously this can be a whole volume of instructions of navigation, is to make sure that this is going to be in a usable format, that it's going to be understandable, that the potential to misuse, at least unintentionally, goes down. Because I think that lots of databases are just thrown out, and then people start producing some very weird results, and they don't recognize that that was not really age, but it was uptake of cholesterol instead of what was the age of the patient.